Hi, my name is Caitlin. Thank you so much for joining us today on Facebook Live. I'm here today with James Quinn, one of our physical therapists, who also happens to be our clinic director, so you're getting the absolute best advice. So he's here with me for Physical Therapy Month, which is this month, October, to talk a little bit more about physical therapy and get some answers to some common questions that we get a lot. So we'll just dive right in. So James, what makes physical therapy different from other medical specialties?
I think the coolest thing about physical therapy is it's not medication. You know, we don't have to just take unnatural substances. It's non-pharmaceutical. You know, it's stretching and strengthening and hands-on treatment to address really the root cause of pain. You know, we're not treating symptoms necessarily, but in a non-pharmaceutical way, we're getting to the actual underlying causes and getting some real, hopefully lasting relief in that regard. Nothing else can do that but physical therapy.
Yeah, that's so true. I mean, you know, things like, you know, painkillers, that's not eliminating the pain. It's just making it so you don't feel it so much. But physical therapy really does get down to like actually solving it.
You're absolutely right. It's not a Band-Aid, right? There we go.
For sure. So what kinds of conditions can physical therapy treat?
It is all over the place. You know, it is so much more than I think a lot of people realize. One of my favorite things to treat is just chronic pain and pain in general. You know, people have been living with pain for years and maybe didn't realize that there are some options out there for them. You know, in chronic pain cases, and probably the reason I really love that is because, I mean, you have people that have had pain for 10 years, sometimes longer, you know, and have had no relief. And they come in here, it's the first time they can maybe get off pain medicine that they've been on for a long time. They can see, you know, live just a better lifestyle because their pain levels start to drop to a more manageable level. From there, you know, I think some other common ones that people don't think of, you know, headaches. I love treating headaches too, because we can have a really strong impact there. And a lot of headaches are cervicogenic in nature. You know, they come from tightness in the spine, they come from tightness in the muscles of the neck. And it's really cool to see somebody who struggle with migraines and headaches for, you know, again, oftentimes a long period of time and see those eliminate. But again, it's all over the board. You know, is it a stiff shoulder? Is it, you know, some hip pain from running, you know, maybe some aging joints with arthritis, interesting cases that we see like fibromyalgia. They all have a place in physical therapy, and we can definitely see some positive results in reducing pain. So.
Absolutely. What like conditions that are maybe more functional and less pain related do you guys see?
I would say the most common one we see is shoulder. You know, where's that limitation? Maybe there's pain, but maybe they're just not able to do what they need to throughout the day because there's maybe a limitation in the movement. But beyond that, I think there's, you know, incontinence, which is one we don't talk about too often, but is very important and can definitely get positive results from physical therapy. Vertigo, which is a unique one, just dizziness. And man, that's always fun to treat because we can get like instantaneous results. I mean, most people come in one day and they leave feeling better that day, which is pretty cool. We don't always have that luxury in our field, but it's pretty neat.
Yeah, that one's always a cool one to watch. Like I'm not a physical therapist, but I've seen you guys do that a few times, and it is neat. It's like night and day. I mean,
right.
I saw one person one time who came in and had been like on the verge of throwing up for like a week, and then just boom, just better. It was crazy.
Yes, it's so cool. You know, it's like
we shouldn't promise those results. Like that doesn't happen
no,
all the time.
Well, we don't always get that lucky, but absolutely. I mean, I would say if there's any one thing, you know, and we always like to see results day one. It can be striking results in that particular treatment. Another one that I'd like to mention, only because I feel like I have this conversation every day, and that is balance, you know, and that goes hand in hand with vertigo, but it's really its own thing. And
Mhm.
I think a lot of people don't realize that balance is definitely a treatable thing. Like, oh, my balance has gotten worse as I got older. You know, I've never had great balance. And
Like,
balance,
oh, I'm just clumsy. It's like,
yeah, right,
we can help
right.
that.
No,
You don't
balance,
have to be.
yeah, right, absolutely. I mean, it's just, you know, it's a brain connection. And then there's muscles involved with balance too. So we can strengthen it and you can improve it. It just takes a little bit of work. So.
Absolutely. So I should say, if you're on here and you're kind of wondering, maybe your condition is one that we didn't mention, or maybe we did mention it and you want to know more about how physical therapy helps, this is all on our website. The What We Treat section is actually one of the biggest sections of our website because physical therapy can help a lot of things. And with our big team of therapists, we really do have a lot of different specialties and a lot of we've been operating for 28 years now, so like lots of experience there. So physical therapy treats it. We've probably treated it before, if not a lot. And if it's back pain, probably 100 times already today. So, yeah. So let's see. My next question, now that we've kind of talked about, what we can treat, what does an average treatment look like? What should someone expect coming in for treatment?
One thing that is, one thing I like about our clinic specifically is we really try to have a manual component, and whatever that means for that patient and whatever they're going to benefit from, be it soft tissue mobilization, muscle releases, joint mobilizations, active, like I'm getting my hands on someone and I'm trying to improve their symptoms via like specific motions or soft tissue manipulations. And 9 times out of 10 people really great results from that. I think it's too often left out of physical therapy treatment. I think it's super important component, and it's just going to accelerate healing. I think you can't do it without the exercise and stretching though. So that's always going to be the next part. I think people are intimidated by that, but the important thing to recognize there is it's all graded. It's graded to where you are day one, and it will change as we see improvement. So where you are on day 15 might be an entirely different set of stretches and exercise or a progression that we started with. But
exercises. We're not saying that your recently torn shoulder. We're just having you pumping barbells or something. It's
no, absolutely. Sometimes, right. Sometimes these things are, they're very specific to what we're treating. It's not, you're not just running a half marathon or sitting on the bike for 30 minutes. You know what I mean? There's a lot more to it than that. But yeah, I think it's those two components together. I think that's what gives the best response. And if need be, if pain is a major factor, there's also what we term modalities that can do a lot of good. Be it, we have electrical stimulation, we have ultrasound. Our newest modality that we're super excited about, of course, is our laser light treatment, which has been showing some really good results already, and we've only been using it for not even a week yet. So I'm getting more.
Yeah, we started Monday.
Yeah, absolutely. And then the exercise and stretching component. So it's multifaceted, and we kind of adjust those little pieces as someone can tolerate or what they're going to benefit most from. And I think you can't really leave out any component. They all kind of go together to give you your best treatment, your best outcome.
For sure. It makes sense that, you need a lot of different methods to get back to where you should be and attack it from all angles for maximal results in minimal time.
There you go. Absolutely right.
Yeah. So when someone's, looking to choose where to go for physical therapy, what should they look for?
I guess I already kind of touched on that a little bit, but I love to see, a therapy clinic that really does a hands-on approach. If you're going to a place that doesn't have that aspect, maybe they're not hitting everything that we need to. So I think that's very important.
Not that you can't have success, but it will likely take longer. And
that's it. And all these pieces, you can't you're going to get somewhere with any one piece, but you're going to get somewhere the fastest if we can get the right combination of all the pieces in, and as things heal, maybe that manual component becomes less and less important, and we can rely more on strengthening and stretching. But early on in the treatment plan of care, it's pretty important to see that. I think you always want to check in and make sure that they have solid equipment and just a good history, a good background. You got a clinic that's well established, I suppose, is always a good thing.
For sure. So, we are talking about like choosing a physical therapy practice. How much choice do people really have about which clinic they go to?
I love that question because people often don't realize that they have all the choice. I think every practitioner maybe has a tendency to refer. Some people refer in-house, and that's all fine. But at the end of the day, a patient has the ultimate choice. So, if you have a place that you like to go, or you want to go, or you've heard of a place that you want to try out, a patient has that ultimate decision. Listen to your docs or whoever you're working with, and if they're don't ignore what they're telling you. But at the end of the day, you do have the right to choose wherever you want to go.
Yeah, and I do want to add just right in there, I know that you have more to say on this, but that sometimes patients don't really realize that some doctors are obligated through their practice to refer to different places. It doesn't necessarily mean that your doctor thinks that that's the best place to go, or your doctor thinks that, that is the end all be all. There are a lot of factors that go into that. And again, I'm not saying ignore your doctor, absolutely not, but maybe ask some more questions about, why they recommend this place, or, what you'll get there rather than other places, and then do your own research.
Right.
Yeah.
Absolutely. You're absolutely right. And I think it's unfortunate because really it shouldn't, there shouldn't be that underlying pressure, but it's there, and it's a real thing. So, but yeah.
So what if you don't, what if you haven't seen a doctor yet? Are there, ways to choose then? We talk a lot about direct access. What does that mean?
I love the new direct access. It does mean, it is health insurance dependent, but if, like Blue Cross and Blue Shield, they now have direct access, which means you don't have to see a doctor first. You can come straight into physical therapy, and we basically do an assessment here, and we can progress. And then, if for some reason we did see or run into any issues, or I were to see something on a treatment, or one of my colleagues were to see something on a treatment that maybe gave us more concern, we could always refer out to a doctor for further imaging or something like that. But we don't need that, most of the time to get started, and to make headway. And oftentimes we never even end up needing it, and we solve the problem without having that component. But yeah, direct access really gives us a great ability. The other thing we have, which is super, super handy, and I love that we do this as frequently as we do here, and that's just a free screen. If there's ever a question or concern, is physical therapy right? Do I need to go to a doctor, or should I start with physical therapy? Call in. You can always come in. We do a complimentary consultation, and we'll just take a look, and we'll give you our best advice on how you should proceed from there. So.
Absolutely. And that's really great, because it enables you, as the person who's actually living in your body and who knows what's going on day to day, to decide which one do you want to start at. And it's not that we won't communicate with your physician, or your physician won't send you to us. It's that you can decide, do I want to start on the physical therapy end and see where that goes, or do I want to start with my physician and see what they say? And then you kind of, through that process, can sort of figure out how you want to make your healthcare team. But I guess sort of the moral of the story is, yes, you can absolutely choose where you want to go. And it's an important choice, where you go really does determine the quality of care that you get, which determines your speed of recovery. It determines, do you meet your goals? So it's not a small choice, so don't take it lightly.
No, right. No pressure there, but yes, no, it is. It can be intimidating. I know that for sure, but yeah, it is important.
Absolutely. So, James, what do you wish more people knew about physical therapy?
one or two things that we maybe already touched on. One, it's just such a wide variety of things that it can treat. And if you're ever in doubt whether you have a condition that is treatable or would benefit from it, again, the free screen is a wonderful tool. So it's just, there's so many things I feel like people don't realize that physical therapy can do, again, whether it be those headaches or that chronic pain, I think we all see it as, more acute things or post-surgical, but there's just so much more to it. The other thing I think is somewhere along the line, I don't know how or where or why, but I think we got this bad rap for physical therapy being like painful. Everybody's like, and in my opinion, it's just not. I know some people are going to have a little bit more of a tougher road and it might be a little harder, but for the most part, I don't want to see somebody in here in pain. If I'm doing an exercise or a stretch or a manual treatment that's truly painful, I'm going to find something else to do, because we're not here to increase pain. That's never going to be a benefit. We want to decrease someone's pain. So, pain is a part of it in the sense that you're coming in with pain and we're trying to get rid of it, but pain is usually our goal is never to cause pain. I don't know where that rep came from. I think it was back when they were first starting to do a lot of total knees and total hips, and the recovery from those are really painful. And there is, especially early on, people were really forcing a lot of motion in the joint. And everybody's like, man, that was miserable. It was really painful. But even those things, the surgery is painful and the recovery can be a little bit of a struggle, but we try to avoid forcing things anymore. And surgeries are getting so much better, but oftentimes we don't have to. So it's pretty cool.
Yeah, and I've seen you guys sometimes adjust a patient, what they're doing in their full program if they're having bad pain, because occasionally, I will get an email that's like, I'm having a lot of pain, but that immediately is a signal to me on the community outreach director side of, this isn't good. I need to let their therapist know immediately. And I immediately talk to whoever they're seeing next. I talk to the lead therapist on their case. We see what day they're next coming in. Like, we jump into action because we don't want you to be that way. And that's not how it should be. We try to figure out, how do we adjust and how do we, change, and, and that part's on James, not on me. I'm not the clinician here, but,
absolutely. No. And I appreciate that. I mean, and I think that draws a good point, everybody from the front desk, on your end, we're all looking out for the patient, and everybody in this field is really, we're here because we want to make people feel better. And that is the truth for everybody here. And it's just not, we wouldn't be here doing it if that were the case. So there you go.
For sure. And I always like to bring this up on, when you mention pain, there are some conditions, like especially fibromyalgia patients, but really any patient, if you're having a particularly bad pain day, that's not a signal to not come into physical therapy. If anything, that should be a day that you do come into physical therapy, because we have the tools to help you with that pain and help you. And we can, kind of adjust what we're doing that day. But we can adjust it such that we're making sure that we can change the goals for that day to get you out of the immediate pain so that you can continue on your path to recovery. So pain is not a reason to not come in.
No, I'm glad you mentioned that too. It was interesting. Mm-hmm. I literally had a patient just yesterday, and she had, for whatever reason, and she wasn't even sure what the cause was, but she had a spike in pain, and so much so that she had almost canceled her appointment, but she decided to come in anyway. She walked in the door, 7 out of 10 pain. We weren't sure why, but 45 minutes later, she walked out the door in literally 0 out of 10 pain. So it was 100% worth her coming in. But there's no way I could have helped her unless she walked in the door. So,
definitely.
And I don't think that, unfortunately, a lot of times those things, they don't just go away on their own. It takes a little.
Yeah, but the reason that you're paying us is because they have the training and the degrees and the tools, both physical and knowledge-wise, to get you where you need to go. So let us do our job.
Right.
So, we've been talking a lot about pain, but pain is something that a lot of people kind of have or live with, maybe at a normal level or just occasionally. So how do you know when it crosses that line and it's really time to go in and talk to a physical therapist?
I think the number one thing is how long, I mean, what have we been dealing with this a day, a week, a month? If something's been present for a week or two and it seems to not be changing and maybe even getting worse, that's definitely a sign. It's different. You wake up with a sore back one day, but by midday it's gone. It's not like we need to call as soon as you wake up, but there are multiple things. I think we sit there and we wait and we're like, is it going to get better? And you kind of keep waiting and you keep waiting. And then you're like, well, I've been with this for like 6 months now and it hasn't really gotten better. Don't wait that long. Wait, a couple of weeks if you're still dealing with something like that. The other thing that can be clear signs, is, was there an actual injury or was it just an insidious onset? I mean, was there something that happened? Were you running and felt like a pull? Something like that. Is there limitation? If I'm moving my shoulder, okay, maybe my shoulder aches in the morning because I slept on it, but everything moves really well. And it's no real increase in pain with motion, but sometimes, you'll get, oh no, I'm trying to lift here and it's just stuck, like that. You want to look at limitations as well.
Yeah, especially if it comes on gradually and then one day you kind of realize you're like, I used to be able to do that and I can't really do that anymore. That's right. A sign. Like, it's time.
Yes, I see that all too often. I'm like, so does it hurt when you do this? Like, let's say, does it hurt when you try to put something on the shelf? And, the response is, they think about it and they're like, well, honestly, I don't know. I've stopped using that hand for so long. I don't even know because I don't use it. Like, oh my goodness, you haven't even tried, I mean, that's been too long.
Yeah. Sure. And I should also jump in and say, like, when we say, it's been hurting for a long time, it doesn't have to constantly hurt that whole time. Like if you have a headache every afternoon or even 3 afternoons a week, that's chronic pain. It doesn't have to be constant. Like that's something that's continuing. Or if it hurts only with a certain activity, if you're like, oh, my knee hurts, but only when I run, it's like, well, you should be able to run. Like, yes. That's continuing, it's not.
Absolutely. Yeah. I mean, if it's something that's affecting your lifestyle and the things you love to do, it's worth getting in and seeing if there's anything we can do about it, for sure. Absolutely.
Awesome. Oh, sorry, go ahead.
No, well, I was just going to say, I mean, I know we already mentioned it, but that is, kind of, again, one of those free screens are pretty cool, because if you're in doubt, come in, we'll check it out and tell you what we think you should do, for sure.
Yeah, those are so cool. I mean, so we've been talking about the free screens, and really just what it is you call us up, you say, hey, I want to come in and talk to a therapist. I'd like a complimentary consultation. And it doesn't matter if you've been to therapy 1,000 times or you've never had physical therapy. It's not like a new people only kind of thing. Like, no, we want to help you all. So if there is any question that you have about something that's going on with your body and you want to know if we can help or if someone else can help or sort of where to get started, then just sign up for one of those. You'll come in, you'll talk to a licensed therapist and just one-on-one about what's been going on. And you'll get answers to your questions. And by the time you leave the room, you will have kind of figured out a plan. And if it's therapy, then they'll figure out how to get you into therapy. And if it's not therapy, like I said, we've been here for 28 years. We know the other places in town. We know if it's, a primary care physician problem, we can send you back. We can send you to them. We have relationships with pretty much all of them in town. If it's some kind of specialist that we think you probably need to check out, we know who those people are too. We know how to get you on the right track to get to feeling healthier. And, it doesn't obligate you for anything. It's just a chance to talk for free to somebody who knows what they're talking about. So there's not really a reason not to do it, because the biggest, barriers that we often see are like time and money, and complimentary consultations are free and not very long. So perfect combination for someone who's just trying to figure out what's going on.
There you go. Absolutely agree.
Yeah, so I do want to ask one more question,
Okay.
but for people who are considering physical therapy or maybe already doing physical therapy, how do you get the most out of your time in physical therapy?
Um, I always, and I encourage this strongly from day one, but communication. I mean, open line of communication with your treating therapist. You know, what's going on, how are you responding to each bit of treatment, you know, is very important. On day one too, I'll usually give a home exercise program. It's never going to be anything crazy. We talked about that. These things are all graded to where we are and what we need. I'm going to pick probably 5 things that I think, maybe even fewer, you know, but 5 or less that I think are going to really be most important to alleviate a lot of symptoms, to get, you know, be it tight muscles or stiff joints or, you know, positioning, things like that, that are going to help and be persistent with those, you know. I pick them for a reason, and be it me or somebody else, they're not just random things. They're specific to you or your pathology, and if you stick with them, they'll help. You know, absolutely.
You're not doing it for your own enjoyment.
No, exactly. No,
You don't just
I know
enjoy giving out
at least I
homework.
know they're home suffering for 15 minutes a day. Right? No, just kidding. No, it is not for my enjoyment. I think, you know, not every patient is one of those super cool vertigo patients that walks in the door and walks out with all their symptoms gone, right? I think
Yeah,
being
that's
a
pretty
little bit
specific
patient.
to vertigo.
Right. Yeah. You know, I think you will see relief in every session, but it takes time to build and to get lasting relief. So, you know, be persistent with home exercises, be persistent with your appointments, because that that persistence equals change. You know, if you come in one session, then you don't come for 2 weeks, and then you come back again, it's like we're restarting the battle over and over again. Where if you make that appointment every time, we actually make forward progress every time. Just persistence, but it gets there. It really does. So.
All right. So lots of great advice today. Is there anything else you'd like to add before we sign off, James?
No, if in doubt, don't wait. I think too many times we kind of wait too long. I'd rather see that pain when it's only a month old than when it's 6 months old. It's way easier to treat. We get faster results. Not that I won't see it at 6, but I'm always like, the sooner the better. And other than that, I think, you know, and the reason I love physical therapy too is it's just, you know, the goal is to always keep people moving, at whatever capacity, that's it. So if you're out there, stay moving. And if you feel like you're not moving how you should, come hang out with us for a little bit.
All right. Thanks so much. And if you have any more questions for us, or if you'd like to talk to a therapist for free about, you know, your specific whatever's going on, you can always give us a call at 785-749-1300. And we'd be happy to talk with you. So thanks for coming out and listening.
Awesome. Thanks, everybody.
Bye.
Thank you.